This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. I'm Joe Sam Robinson, and it's my pleasure to have with us tonight Dr. Frank Kelly. Welcome, Frank.
Thank you, Sam. It's a pleasure to be here.
Well, it's great. It's great. Now, Dr. Kelly is a well-established and well-known orthopedic surgeon, so it's good to have you here. I will say that for the TV audience, there's a little friendly, I guess, rivalry that goes on between orthopedic doctors and neurosurgeons. Is that right, Frank?
Well, that's right. It goes back a long time. I appreciate you having me and appreciate the kind words.
Yeah.
We'll see what we can dig up
Well,
this evening.
I might make some jokey comments here to tell the audience that Dr. Kelly and I both had tremendous athletic careers in our younger days. Is that correct, Frank?
In our much younger days, and I'm not sure how tremendous they were.
Yeah, they were sort of cut short at an early age, but I think we've been to knowing one another for many, many years. So it's great to have you with us tonight. And I can make one other joke, if I can say that, or one other comment, is I'm told that your senior partner, Dr. Chuck Richardson, he tells me he's taught you everything you know. Is that correct?
Well, I think it's the other way around,
okay.
but I let him get away with that.
Oh, okay, good. Well, I wanted to bring his name up. He's telling that story, Frank, so good.
I'm glad you brought it up. He'll be proud of that.
That's good. Well, maybe we could start off talking about your journey through life, and you've become an orthopedic surgeon. You grew up in Macon, and how did that happen?
I did.
What exactly occurred?
I grew up in Macon, just a few years behind you.
Yes.
Like you, I went to Lanier High School.
Yes, many years ago.
I tried basketball. You did football. After that, went to medical school over college at North Carolina, and then medical school.
Chapel Hill, is that right?
Chapel Hill is my alma mater. Returned to Georgia back in the late 1960s for medical school.
Yes.
And then after my orthopedic training in Memphis, Tennessee, came back to Macon in 1978 and started practice.
So you've been here a long time in this area doing orthopedic procedures. And I think you had particular interest in joint issues, do you not?
Exactly, right. This is my 34th year here, and I did as my practice evolved, I became more and more interested in hip and knee joint replacement surgery, and did a lot of that.
Yes. Well, that's great. Now, also, you have tremendous political skills and interest in national issues, and I think you've have played a leading role in the orthopedic community in regards to their national organizations, and maybe you could talk about that.
Well, you're kind to say so. I did. I got involved, probably 10 or 15 years ago with a national organization, which is called the American Academy of Orthopedic Surgeons.
Yes. Now that's a big deal. Not every young boy can get in that. Is that right? You have to be board certified.
It's
a big deal.
You have to be board certified, pass certain credentials to get in.
Yes.
And then I was fortunate enough to sit on our board of directors for 7 years.
Yes.
Our academy encompasses some 24,000 orthopedic surgeons around the world. So it was a real privilege and honor to be involved with some of the leadership of that organization.
Yes. And so as American healthcare has been restructured and efforts are underway for reformation, you've really had sort of a catbird seat in observing that from a national level, and you've witnessed some of the political issues here. Right. Is that a fair statement?
That's a very fair statement. Through our organization, we did go to Washington once or twice every year to meet, if you will, with our members of Congress. And at the state level as well, trying to, if you will, educate them on issues that were important to us and to our patients. So having done that for the past 10, 15 years, I feel like I had a pretty good handle on the changes that have been made in healthcare.
Yes. Now we sometimes, I guess, we criticize the politicians, that whole process out here in Middle Georgia. We sometimes think, wow, that seems to be out of control a little bit. But do you have any observations about everything that's happened? Are we getting the points across that are appropriate points for protecting patient welfare? I mean, what's happening exactly?
That's a great question. I think you phrased it exactly right. We need to do try to do what's best for our patients.
Yes.
And I don't know really if we've been totally successful to this point in doing so.
Yes.
I think I share with you some concerns about the so-called Obamacare or the Affordable Patient Health Care Act. There's some good parts to it and some parts about which I have some very legitimate concerns, I believe.
Now, it's going to be easy to talk about all the bad parts, but so let's talk about some good parts. I mean, really, really, there's some things that are appropriate to talk about, and it needs to be part of the national debate. And it's not altogether bad what's transpired about having. We have to talk about these things. So, what are some good things?
There's several excellent points. Number one, if it works out like they plan, it can really expand health care coverage to some 32 million Americans who are now without insurance. So I think that's obviously a good point.
Okay.
Secondly, children now up to the age of 26 can come under their parents' insurance plan. So if they can't afford an insurance policy, they can still use their parents' insurance until age 26. Thirdly, the so-called pre-existing clause. As you know, certain insurance plans now, if you have a pre-existing condition, they won't insure you. One good thing about the health care legislation is that children with this legislation will be covered even if they have a pre-existing condition. And starting, I believe, in 2014, the same provision will apply to adults. So I think that's a reasonable and a good thing. Fourthly, for Medicare beneficiaries who are getting prescription drugs, some of those fall into a so-called donut hole where they lose some of their coverage. Those individuals will get a rebate, some $250, I think. And another good thing will be group policies, individual policies will fund preventive care without the patient paying a copay. So I think, you know, if you could ounce of prevention, maybe worth a pound of cure. So those are all reasonable and I think legitimately good things about the healthcare legislation, if in fact they all come to be.
Now, so much for the sugar coating. I mean, there's a beneath that's the sugar coating, but I think the idea is to basically make. I think the Western European democracies. I think that's the role model for what's the experiment that's coming our way with our healthcare system. And the universal coverage is an attractive thing. No particular, a very wide net for everyone. Some complicated ways that's being put in place that maybe sort of make things substantially more difficult than is at first evident. Now, how about some of the difficult things, Frank? What are some problems with all this?
And you know, there must be some difficult things because I think still if you take a poll of the American people, some 55 to 60% of Americans still favor repeal of Obamacare. So what are the issues? Number one, and I would say probably foremost, would be how is it funded? Okay. It's a $1 trillion initiative. As people say, it's 1/6 of the U.S. economy. So how it's going to be funded? Probably half of that funding will be coming from Medicare cuts. And if you cut Medicare, you're limiting access of our patients to our services. So, you know, half of the funding is coming from Medicare cuts. Another half from taxes that will be applied to a number of different individuals.
Now, Frank, do you think that actually they're going to do these cuts? I mean, we've seen the government in action for a long time, and that's one of the issues. I think it's appropriate in this venue to discuss that. We have the faith that we have out here in Middle Georgia and what happens in Washington. I think has been progressively eroded. So do we actually believe that's going to happen? Is there some guarantee these cuts are going to take place? I mean, it's guaranteed?
You know, it's interesting you mentioned that because that is a key part of the health care legislation is cuts to the providers. You know, they said for the last 10 years, every year there will be a cut for the providers, but it seems like at the last minute that cut is pushed off until the next year. If in fact the cut comes to be that they promised, it'll be a 30% cut this coming January. So will it happen? I bet not. I hope not, because I think if it does, what you'll see is that a lot of providers, physicians, will start limiting the number of Medicare patients they see. It'll be a huge problem in access to our, for Medicare patients. Right now, some 17% of physicians already restrict the number of Medicare patients.
Yes.
With a 30% cut in reimbursement, I can see that just going way down. So I hope it won't happen, because if it does, it's going to be a huge problem to our patients. You and I are Medicare age, right?
Well, I'd like to say speak for yourself, Frank, but unfortunately I'm past the bar myself.
And I'm a year away,
yes,
but
right.
so I think it's going to make a huge impact on a lot of us. So obviously, Sammy, funding is one of the huge issues that a lot of people have.
So this, I mean, these cuts are not just for physicians. I mean, maybe that's not everyone's favorite press group there, but it also is just right through the whole apparatus. So,
sure.
So home health services are being cut. There'll be cuts to hospitals. Just if you're an older person that depends on Medicare, it's not just physicians, but everywhere this is happening. And the government has been quite vague about how they intend to do this, other than there is this physician cut that is in the offing, and we'll see what happens. It's unknowable what's going to occur, other than a lot of the funding is vaguely stated cuts in services to senior citizens. And so what's another way they're going to try and make the numbers work?
Okay, so obviously they'll have the cuts to senior citizens, the Medicare cuts, they'll have huge tax increases. The Medicare payroll tax will go up to certain individuals. Certain, what they call the Cadillac health plan, if you really have good insurance coverage, that will be taxed, an excise tax at some 40%. Manufacturers of implant devices for orthopedic care will be taxed. Pharmaceuticals will be taxed. So there's $500 billion supposedly of Medicare cuts, about $500 billion of new taxes. So that will be a huge impact on a lot of people, in fact it goes through.
And so we have this complicated thing about the state of the economy. We have all these issues about dropping American living standards. The fact the economy is in the doldrums here. We have lots of economic tension out there. The idea of putting these new taxes on board, that's a little spooky. And I don't know if there's been any consideration to what that would do to the gross national product to have these additional government taxes imposed. And any comments about that?
I think it'll make a huge impact. And the unfortunate thing about all of this is that not many people are aware of all these various taxes.
Yes.
You know, I think when the bill came out, what did they say? We need to pass it so we can find out what's in it.
Right.
You know, it had 2,500 pages of legislation. And a lot of these taxes are sort of hidden in the fine print. So yes, you're right. It's going to be a significant impact on the economy, significant impact across the board. So obviously funding is going to be a problem.
Yes.
You know, another issue that we have with the pending legislation is the quality of care.
Yes, which is incidentally a big deal. And we're both on the same team. We want the best possible care. All physicians do. I think that's fair to say.
We want the best care that we can afford. But you know, they say they're taking these 32 million folks and providing insurance. But the question is, what kind of quality care will they afford? Will it be quality of care such as some of our Medicaid patients receive, or what? We just don't know. Is that a good answer? Certainly, quality of care and funding are two big problems. A third problem that's not addressed at all that I can tell by the healthcare legislation is tort reform. You know good and well that billions of dollars are spent every year on so-called defensive medicine. Without meaningful tort reform, these defensive medicine costs will continue to escalate. It's a huge problem. It's very minimally addressed in the healthcare legislation.
Well, you know, I will say that maybe for viewers of this show, I try to straight I'll speak his name with due deference, former Congressman Jim Marshall. We had a little discussion about that, about exactly what the impact was. And I think you would join me in saying that it's very understated. The cost of defensive medicine are very understated, and a big deal would be to allow common sense to enter this equation. That would be a big deal, and we could really do something big time about that. And no one wishes to sacrifice the rights of people to redress for some terrible thing that's occurred. But we need to have just the system just needs to be reevaluated in light of the national health care crisis. I mean, I think that's fair to say.
There needs to be some provision to at least look into it and see if meaningful changes. There's some decent things that can be done. What you said is exactly right.
Yes.
Those who have been harmed need, they deserve to be reimbursed for their injury. On the other hand, there seems to be a fair number of frivolous lawsuits that go through 2 years and 3 years of litigation,
yes,
and then are thrown out or cited in favor of the doctor.
Yes,
It's just
yes.
a lot of money, in my opinion,
Yes.
is wasted in defensive medicine and in the whole malpractice scheme altogether. Another issue that comes up is the so-called individual mandate.
Yes.
This is
you're really this is my head is spinning with a list of all these things, Frank.
Well,
so it appears it's going to be rather a complicated journey into federal regulation quite soon. So what's another thing that's here?
Well, the mandate requires those who pay income tax,
yes,
to purchase some type of health insurance.
Yes.
That's the linchpin behind Obamacare. If
Yes.
that doesn't work out, then it's hard to conceive that the rest of the plan
Yes.
will. Right now, it's up in the air. It's, as you know, it's been looked at by 3 federal appellate courts.
Yes.
2 have decided it's constitutional. The one in Atlanta, the 11th
Yes,
Circuit,
yes.
decided that the mandate was not constitutional. It'll be going to the Supreme Court probably in October, so a
Yes.
decision will be made probably by next spring if, in fact, they can take this issue up in October. So that's the problem. Another problem is a board that's set up. You've probably heard about the Independent Payment Advisory Board, or Physicians Advisory Board. It's a board of unelected board of 15 individuals who will be charged with mandating Medicare cuts. This board is accountable to no one. They will be in charge of deciding how Medicare works. There's right now a definite desire to repeal that provision of Obamacare. So that to me is another potential problem.
Now here, this is a serious issue here, and I mean I think the viewers need to be informed of this. The way that healthcare is rendered, the complexities of that, the individual decisions that are made between a patient and a physician are very complicated, and it requires lots of things to be considered. The patient's general health situation, his desire for a particular type of lifestyle, lots of, is this son graduated from high school? Does he want to do this or want to do that? Does he like to play tennis? Does he want to, whatever it is. I mean, all these things are part of our healthcare system. And I think what we're concerned about is an arbitrary and capricious rationing of healthcare from an unelected body of 15 people. I'm going to just keep bouncing the basketball about this because it is extremely complicated to decide what is the appropriate use of resources, and it requires enormous scientific evidence, and it's a very daunting task. And in general, the outcome analysis apparatus is very unformed and difficult to put into practice. It requires lots of attention and lots of discussion. So the difficulty that would occur is if this star chamber kind of apparatus were there, propagating different kinds of regulations that denied people care with no appropriate venue to get this corrected. Now, are these people approved by the Senate? To me, this is an important position as being on the Supreme Court.
They are not.
There's
they
no
are appointed by the administration. To my knowledge, I do not think they are necessarily approved by members of Congress. Once this board is constituted, they'll make these decisions just like you've described, and they're really not accountable. Their decisions will not have the oversight of Congress, so they can make very sweeping decisions. And the scary thing is, here we are as physicians and healthcare providers with lots of years of training,
yes.
doing what we think is best for our patient,
yes.
trying to use the resources in a correct and
right.
reasonable manner, and basing our decision not only on our knowledge, but
yes.
upon our experience of taking care of patients for
yes.
years. But here's another group who doesn't doubt they have the medical expertise that we do, trying to go by some cookbook and telling us that perhaps you can't have an MRI in this particular case, that this is an unreasonable use of resources. To me, that just is a very significant drawback of the healthcare legislation, and one that very few people know about, but it can have a huge potential impact, a negative impact, not only on our physicians, but primarily on our patients who will be receiving care.
So this is a huge deal. And right now, at least what I know about some of these regulations that have been propagated particularly for Medicare. They're really, how can one phrase it, disturbing. I would say that's disturbing. I recognize the idea they're trying to do the right thing, but many times the problem is the feedback that's possible for a particular patient. If you're trying to look after the patient's welfare and there's some kind of arbitrary government regulation, it's extremely difficult to do anything about that. And a lot of what's happening is the way rationing happens is changing payment protocols. So if, for instance, the government says, well, we're not going to pay, I don't know, whatever, for a BK amputation, we only pay $5 for it, then no one is going to have a BK amputation. If the government says for chemotherapy for a particularly rare kind of cancer, we're only going to pay $5 for it, then what that means is there won't be that kind of chemotherapy. So they can, just by manipulating the payment arrangements, they can effectively do anything. And just to keep talking about it, it is not impossible, to quote Lord Acton, that absolute power corrupts absolutely. And it could be this Star Chamber arrangement could really do things that would be extremely evil. They could be brooding about rewarding particular politicians, particular districts, if the president's mother-in-law has gallbladder issues, then maybe a lot of money will go in that direction. I mean, and so that is a very frightening situation. And I would say, certainly, I hesitate to use the word un-American, but it matches my definition of un-American. Well, all right, Frank, I hope I wasn't too tough on that point. Keep going there.
Well, I think you're exactly right. In fact, our academy, I mentioned earlier, American Academy of Orthopedic Surgeons, this is one of our key issues on our education efforts to our members in Congress. They need to know about this payment board,
yes.
And they need to realize the potential deficiencies and problems that be created from it. So I think there are a lot of, obviously, as we mentioned earlier, there are potential benefits. There's some significant drawbacks, so the question is, what do we do going forward? What kind of changes can be made to improve healthcare in the United States, and maybe take some of the good from the healthcare legislation and try to tweak it, if you will, and make
All right,
it
Frank,
better.
I'm going to throw you the basketball. I will tell the audience that many days Dr. Kelly was a tremendous basketball player and a real terror on the court. But what were some suggestions that you might make to improve the
First of all, I would say in regard to our basketball, that we get better as we get older and forget about things, don't we? But we did have a good time playing.
That's right, yes.
So what can you do going forward? Several things. Number one, I strongly think that the tort reform needs to be a part of this legislation.
Yes.
Defensive medicine is hugely expensive, talking about billions of dollars, so you can save some money and I think improve patient care. Secondly,
now, should doctors, just talking about that, should we try and, it should be proactive. Physicians should be proactive, and if there's something amiss, they need to, all physicians need to step forward and say something. I think the public would expect that. If we're going to have tort reform, then it becomes the profession's responsibility more than now, just to say, well, look, we didn't like that, and I think the public would expect that, and it would be a reasonable task to assume.
Right, and I think you're exactly right. We need to step up. We need to be proactive in this. We need to get meaningful tort reform, whether it's at the federal level, which would be ideal, or at the state level. The difference in that is at the state level, it requires a constitutional amendment to the state constitution to make it effective.
Right.
But we do need to step up to the plate, and but I really think that
would be a big
strong,
thing. Okay.
Would be a big plus. Secondly, I think we need to look, if you will, at what you might call our best practices. What works effectively in delivering health care in a cost-effective manner. I'll give you one example. In orthopedics, particularly in joint replacement, we are trying to institute through our academy what's called a joint replacement registry. Now, they've had these in Sweden for 20 years. Every joint that's implanted is followed yearly. If there's a problem that happens with that particular joint, it can be identified early. The physicians can stop using that particular joint so that other patients don't have to go through what certain patients did where it didn't work out well. Could be a huge savings. I think it's estimated $650 million the first year. Over a period of a decade, $20 billion. That's a significant savings, and not only does it save money, but it improves patient care. So, you know, $20 billion may not sound like much, but $1 billion here and $1 billion there adds up.
Why hasn't that happened, Frank? I mean, why hasn't that happened?
Yeah, a lot of problems with it. How do you pay for that is a big problem. Do you get the government involved? Do you do it with private payors,
yes.
Individual physicians, individual hospitals?
Yes.
We've been working on it for several years now. It's coming closer and closer to fruition, but we're just not there yet. They did it in Sweden. Sweden's got a little bit different type of healthcare system. But if it can be done, it'll be a significant savings. Thirdly, what else can you do? You know, they're pushing ideas forward on new payment methodologies, if you will. I don't know if I'm for these things like bundling of patients, hospitals and physicians bundling their patients' payments. Maybe that could reduce costs. There's a new initiative that you've heard of called Accountable Care Organizations, where physicians and hospitals combine together to provide care, and maybe they could do that more effectively. I don't know that I'm for this. I think we don't know exactly the details yet, but I'm just thinking going forward, maybe something like that could be effective.
Well, one thing too, Frank, is, I mean, just getting the physician having the ability to recommend changes in efficiency. I mean, we all know the best way to do things. Many times we could get a patient out early, the bed could be cleared, maybe the patient doesn't need 6 days of antibiotics. I mean, all these things, suggestions we can make, and the problem is that we don't have the forum to do that in, and we don't get the numbers about how these expenses are occurring. So that'd be a big
but you're exactly right. I think physician awareness is such a key, and you're right. Most physicians don't realize how much money can be saved, so we're partly at blame.
Right.
Fourthly, as far as what can be done going forward, and this is something that probably hadn't been mentioned very much in the media, but to me, it's the main way we can save money in healthcare and make healthcare better, and that is personal responsibility. Okay, smoking, obesity, exercise. You know, so much can be done. Think about it. Probably a third of our population now is either obese or morbidly obese. Think about the problems related to that. The diabetes, heart disease, wearing out our hips, wearing out our knees, wearing out our backs, peripheral vascular disease. So many problems could be avoided if we could just teach healthy lifestyles to our patients. Think about smoking, heart disease. You hear about lung cancer, that's the big thing, but think about all the other issues, the heart disease, chronic lung disease that your brother takes care of all the time, peripheral vascular disease, and not only that, wound healing problems. You know, in orthopedics, working on someone who is a smoker is completely different from working on someone who's not a smoker. Oxygen doesn't get to the tissues, wound healing is delayed, so obesity, smoking, and if we could just get folks to exercise 30 minutes a day. Think of it, you've been a good exerciser for 75 years, however long you've been around.
You know, these patches help. That's a little joke. Well, so those are very timely suggestions, Frank, and I mean, we have there's a lot to talk about. We don't have really all the time in the world to do this. But I think the public needs to understand that this is an ongoing process about the whole healthcare reform issue. And it hasn't been decided by any means as to what's going to occur. It's still in the courts. And there needs to be some more debate about this. And we need to be able to fine-tune things.
You know, we may have lost the battle, but that doesn't mean we've lost the war. There are ways that we can make tweaks to the legislation. Supreme Court rulings will be interesting when they come down the pike. So I think we just need to stay actively involved and do what's best for our patients. I think that's the bottom line.
Well, I think that is the real mantra of anybody in the healthcare field. I mean, that should be the number one thing that we try and accomplish. Well, we're just about out of time, Frank. I guess I haven't had a chance to ask you any of your athletic vignettes.
That would be a brief interview.
Or to talk some more about these allegations Dr. Richardson is making.
They're all false.
All false. Okay, well, great. Well, it's been great to have you here, and just keep up the good work. And you're really a knowledgeable guy about all these things. So.
Well, Sammy, you're very kind. Thank you for having me. I've enjoyed the conversation.
Great. Thank you so much for being here, Frank. Thank you. Thanks.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.